Do you consider the risk of negative public opinion in the pricing of that drug?
This is ridiculous that we are getting gouged when people around the world are getting a better deal.
If it's a hard question to answer, it just tells me something about how willing you are going to be to help us with this problem.
If you do not make a meaningful action to reduce prescription drug prices, policymakers are inevitably going to do it for you.
And that was some of the nicer stuff. The Senate Finance Committee today grilling major pharmaceutical bosses who are on Capitol Hill over these soaring drug prices. Some saying they went so far as to collude to soar those prices, but they include some of the most popular drugs and treatments for anything from diabetes to cancer to just the common head cold. Let's go to Fox Business Network's Hillary Vaughn on what went down today. Hillary.
Hey, Neil. Well, senators today searing the 7 CEOs in the hot seat, saying they don't want lip service or, quote, happy talk. They want it in writing that they will drop drug prices for patients. Senators accusing Big Pharma of price gouging and taking advantage of American taxpayers by accepting government handouts and, in return, ripping patients off at the counter by hiking prices.
If the taxpayer is paying that money for something which over the counter is $200 a month, and we're paying $2,600 a month, it is almost as if the taxpayer has stupid written on their face.
I think that you charge more here because you can. And American taxpayers are subsidizing all of you. The people in Michigan and across the country deserve better. They need to be able to afford the medicine and not have to go to another country to get it.
Executives from Pfizer, Johnson & Johnson, Bristol-Myers, and other companies actually agreed that high prices are a problem, but they say it's up to Congress to fix it. They want the government to get rid of rebates because they say the middleman that negotiates supply between the drug makers and the insurers and the pharmacies are scooping up savings that should be passed down to consumers.
No one company can unilaterally lower list prices without running into financial and operating disadvantages that make it impossible to do that.
Nobody in the system can do anything, can fix it by themselves. The government has to step up and change the rules. And those rebates have to go.
And Neil, it seems like the government is stepping up. There is a proposal on the table to get rid of these rebates, but they want it in writing that will be passed down to consumers. Neil?
All right, Hillary, thank you very much, Hillary Vaughn. So did Chuck Grassley, the chairman of this august committee, get the answers he wanted? He joins us right now. Senator, were you satisfied with these guys' answers?
Partly satisfied with the answers, but the more important thing is they all admitted there need to be some changes made. There wasn't as much finger pointing to others as I thought there would be, and they made a commitment to work with us. But remember, this is just one step that we're taking with the pharmaceuticals companies. In a few days or weeks, we're going to have the pharmacy benefit managers in. They're the ones involved in mostly in the rebate issue. There's $170 billion difference between list price and what the price the consumer pays, so $170 billion.
I know a lot of those drug company CEOs, sir, were the ones fingering some of the pharma benefit managers that coordinate rates between insurers and employers, and that the drug company guys, this is what they're saying, are stuck holding the bag. Did you believe them?
No, but I'm not going to put all the blame on the pharmaceutical companies, because we're going to have this hearing coming up, and we're going to have to go through the whole from the manufacturer to the consumer, and the government plays a role in this, and we need to solve this issue from top to bottom.
Do you think that our medical care today, Senator, is geared to the wealthy? In other words, if you have a tough disease and you're wealthy, you have better prospects than if you were not. And that's why there's an allure to cheaper drugs, the same sometimes drugs that sell here or abroad much cheaper, that compels Americans to go abroad to get the same thing.
Yeah, I think the only place I could agree with you on the wealthy versus lower income people, wealthy have more options, whereas if you're on government programs, you're pretty much in a position where Washington, D.C. is going to dictate. And
so you would not be for the approach some of your Democratic colleagues are espousing, that Medicare handle this, and given its hefted size, it could negotiate or use that to leverage these guys for lower prices?
Well, first of all, you're talking about Part D.
Right.
I was chairman of the committee 15 years ago. The last time I was chairman, I led the effort to get Part D in, and it's the only program I've been involved in that has come in under budget and still under budget. So when I see something working, then if it ain't broke, don't fix it. And I think we also have letters from Congressional Budget Office. Now, maybe these are older letters, but I'm going to get some updates on it that says that the government negotiates. It really doesn't save money in the end. And worse yet, when the government negotiates, the government really dictates, and then you have smaller formularies, so that what your doctor says you ought to have may not be on the formulary. And so with a lot of different plans that people can go into, and with different formularies on different plans, then you have more choices. Where if the government runs something, as they do in the VA, you have probably 2/3 the pills on the formulary because the government is dictating exactly what you need.
You don't even have to worry about a government plan. Now, I don't hide this from people, Senator. I have multiple sclerosis. I'm fortunate enough to be able to afford the drugs, and thanks to my insurance, to treat me and to do okay. Now, there are people who have conditions just like mine who don't have access to that because of these sky-high prices that only some can pay. It's not even a government issue. Should something be done about that if it isn't reined in?
Well, yeah. I think, for instance, the extent to which I have legislation in to do away with the pay for delay scheme, or the acronym, another bill, CREATES. Get generics on the market faster, have more competition.
All good ideas. Senator, thank you very, very much. It's good catching up with you.
You bet. Goodbye.
All right, and he says there are going to be more meetings than there should be, because this should not be a means-based system. We are all human. We all have to get well, and it shouldn't depend on our wallet.